Hey, my name's Hudson. I'm the EMS director here for the hospital. I'm also involved with emergency preparedness for the hospital. In response to the recent Ebola patient that was diagnosed in Dallas, our infection control officer and the chief nursing officer came to me and asked if we could set this up as practice. This is what's called an environmental containment unit, also known as a negative pressure unit. For isolation of patients that may be contagious. It just has two zippered doors and you can attach it to the doorway, and once you put this HEPA filter into it, it starts drawing air out of the room and filters the air 99.99% through a HEPA filter, so no contaminants from inside the room can get out. As you can see, it's pulling negative pressure from inside the room. Even if there's a small opening like this, if you'll feel the air's coming in through here, it's pulling air from the outside, it's pulling air from the inside. All the air is being drawn in here and exhausted through that. If you put your hand down in front of there, you can feel, and that's on low. That's why it has the ability to do a whole hallway, multiple rooms. You can crank it up and it'll really pull the air out of a whole entire hallway. So there's no contaminants that can get out of the room once it's sealed. Everything's being sucked in, so there's no way for a contaminant to get out. If there was a patient that was brought into the hospital that had to be quarantined, this unit is something that we would probably set up to keep the patient in negative pressure isolation until they would be transported out of here, probably to a level 2 trauma center.